Symptoms of cervical inflammation. Cervical pain, if neglected, can contribute to postural issues and joint degeneration. Let's explore how to identify it at the earliest signs to manage it effectively. 1. Neck pain. One of the primary symptoms of cervical pain is localized discomfort in the neck, which can range from mild to intense and may be continuous or intermittent. In some cases, the pain radiates to the shoulders, upper back, or head, causing bothersome migraines. It is important to monitor the intensity and frequency of this pain, and if it worsens, consult a doctor to avoid long-term complications. 2. Neck stiffness. Stiffness, often accompanied by a persistent sensation of muscle tension in the neck, is another very common symptom of cervical pain. This stiffness can make it difficult to move the neck in different directions, negatively affecting even simple daily activities. 3. Headaches. Headaches associated with cervical pain are known as cervicogenic headaches, which originate in the neck and extend to the head, particularly the temples and nape. This type of headache can be especially aggravated by sudden movements of the neck and head. 4. Dizziness. Inflammation or compression of nerves in the cervical region can send abnormal signals to the brain, altering the perception of movement and balance, leading to dizziness. Additionally, receptors in the cervical spine help detect the position of the head and neck relative to the body and the surrounding environment, contributing to balance. If neck pain or reduced neck mobility occurs, proprioception can be impaired. In some cases, this creates a discrepancy between the sensory data perceived and what the brain expects, giving rise to the sensation of dizziness. 5. Tingling and numbness. Tingling and numbness in the arms and hands can be symptoms of nerve compression in the cervical spine, caused by disc herniation or cervical spondylosis. The persistent presence of these sensations can interfere with daily activities, making tasks that require manual dexterity, such as writing or lifting objects, difficult. 6. Muscle weakness. Muscle weakness often accompanies cervical pain, especially if compressed nerves affect signal transmission to the muscles. This weakness can compromise the ability to perform tasks requiring strength in the arms or hands, such as lifting weights or opening jars. 7. Joint noises. Joint noises, such as creaking or clicking during neck movement, can be a sign of cervical problems. These sounds are caused by degenerative changes in the cervical joints, such as arthritis, and are very bothersome, although not always accompanied by pain. 8. Balance problems. The cervical spine houses nerves involved in sensory perception and coordination. Some individuals experience difficulty maintaining a stable posture or feel unsteady while walking because the neck receptors that aid balance are compromised. If the neck is inflamed or damaged, these sensors can send confused signals to the brain, altering the perception of movement and impairing balance. 9. Sleep disturbances. Sleep disturbances are common in patients with cervical pain, due to the discomfort and stiffness that make finding a comfortable sleeping position difficult. A lack of adequate sleep, in turn, worsens cervical inflammation symptoms, creating a cycle of pain and insomnia. 10. Difficulty concentrating. Cervical pain can indirectly affect the ability to concentrate, especially if the pain and discomfort are constant. Headaches and dizziness can make it hard to focus, negatively impacting work performance and quality of life. 11. Shoulder pain. Shoulder pain, often felt as dull or burning and worsened with movement, can be linked to cervical issues due to the branching of neck nerves. Recognizing this pain's origin in cervical inflammation is important for proper management. 12. Visual problems. Some patients with cervical pain experience visual problems, such as blurred vision or difficulty focusing. These issues may result from tension in the neck muscles affecting blood circulation to the eyes, making clear vision challenging. However, it should be noted that the relationship between neck muscle tension and visual problems is complex and requires further research. 13. Feeling of fullness in the ears. The sensation of fullness in the ears is similar to what one feels during a change in altitude. It is caused by tension in the neck muscles affecting the inner ear, creating a sensation of pressure or blockage. Finally, it is worth noting that symptoms can vary from person to person, and that only a medical examination can provide a proper diagnosis. If you enjoyed this video and want to support the project, comment, subscribe, or send us a super thanks. Your contribution will help us create new videos.